Welcome back.
All right, welcome back. In health news, beautiful actress Hayden Panettiere. She checked herself into a facility to get treatment for postpartum depression.
Hayden's one of the stars on the show Nashville and has a 10-month-old daughter. And I heard this morning that her character in the show also had the problem that she's portraying. And there's no connection to that. But
kind of ironic, though.
Yeah, we're learning more about postpartum signs and treatments.
Okay, Celeste is live with more. Good morning, Celeste.
Hey, good morning, you guys. This is something I think that for a lot of people it's difficult to talk about when you talk about postpartum depression and the symptoms, because as a new mom, you go through those early weeks, those early months, you may think, you know, I'm just tired, this is normal, or feeling, you know, sad, this is normal, but a lot of times it can't be. Dr. Anna Shier, thank you for your time this morning.
Thank you.
Psychiatrist, that is. Tell me about some of the symptoms. What women should look out for in terms of postpartum depression, because there's a big gray area.
There is, and I think what you mentioned is really key, where there's a period of time where there are quote-unquote normal symptoms, and those are considered the baby blues, postpartum baby blues, and that's crying, sadness, feeling tired, maybe feeling irritable, all the things, though, that you would expect to happen if you're barely getting any sleep because you have a newborn.
Absolutely.
The tricky part, though, is when it starts to last more than a week or two, that's when we have to start to think that maybe this is postpartum depression. And it's that gray zone that transitions over to, now I don't feel like being alive, or I feel worthless, I feel like I can't be a good mother. You're having problems bonding with your baby. All of these things that are so crucial for your relationship with your child to progress are lost because your mood has dipped to the point where you just can't pull it back anymore. So really it's a timing. If it's past a week or two, then I would say don't even mess around with it. Just go into your doctor, either your primary care doctor, or call a mental health specialist such as myself, so that you can really find out what's actually going on.
And you said it really has to do with hormones and a big drop in estrogen.
Yes. There's a number of shifting and dropping hormones when you give birth. So dropping progesterone and estrogen, your thyroid levels are changing. That all contributes to a sense of tiredness, fatigue, and if you have some other things going on, like a loss of a job or a move, or you don't have very good family support, all of those things can combine, the environmental and the biological, to turn into something like postpartum depression.
You know, in the case with this celebrity who admitted herself yesterday, her baby's 10 months old, a little older than you would normally associate postpartum depression with. But you were sharing earlier that anything after 6 months is not normal, but it can happen.
Yes, so if you have untreated postpartum depression, it can actually turn into chronic depression, lifelong depression. So it's very, very crucial that you get treatment immediately so that it can turn into something that can be treated and you can leave behind. Typically it takes about anywhere from 3 to 6 months to resolve, but one very, very important fact is that once you are on medication and feeling better, you need to stay on the medication until your doctor tells you to go off. Otherwise you're at risk for relapse. And once you start to have relapses, then you're at risk for it becoming chronic and for it becoming a lifelong struggle that you have.
What's the longest you've seen, either in research or in your practice, in terms of a woman actually having postpartum depression?
So at some point after about a year or so, you no longer think of it as this is postpartum depression, but it becomes actual chronic major depressive disorder. So I've seen people 5, 6 years later who, told me, I was on a medication before, 5 years ago, 6 years ago when I had my child, and I thought it went away and I stopped taking it, but I've just never felt the same. And they come into me and they have full-blown symptoms of depression. So for them, it's no longer postpartum 5, 6 years out. Now it's depression. And the question that I think we're not quite sure about, but that we're leaning towards, the answer is that if it had been successfully treated, there's a much, much greater likelihood that it wouldn't have came back and it wouldn't have become a chronic issue throughout their life.
Absolutely, like if you stayed on the medication, something like that.
Right.
Okay, Dr. Anna Shier, thank you so much for your time. Appreciate it. Thank you for the insight. And it can be scary, guys, when you're going through something like this for a lot of women, new moms, things like that. Even for this mom who's a celebrity, 10 months old, and you think something is definitely wrong, and you go to your doctor, and she self-admits herself, and fortunately she's getting help now.
Yeah. Oh. All right. Well, good information for sure. Thank you, Celeste.
Thank you, Celeste.